and I give the call to the member for Higgins.
Thank you very much, Madam Speaker. I rise in this chamber to support the member for Leichhardt on his motion to recognise World Tuberculosis Day. Madam Speaker, tuberculosis, more commonly known as TB, is preventable and curable, and yet every year, as mentioned before, 1.7 million people die from TB. This is an unacceptable mortality rate. TB is the world's most common cause of death from a single infectious disease and the 10th most common cause of death worldwide. TB is one of the largest causes of death in many parts of the world, including sub-Saharan Africa, parts of Eastern Europe, South Asia, and the Indo-Pacific region. Without an affordable diagnostic test, a reliable vaccine, and with the duration of the treatment becoming longer with the advent of multidrug-resistant strains, worldwide efforts to curb the prevalence of TB, while positive, still battle to succeed. While Australia has one of the lowest rates of TB in the world, it is extremely common in our Pacific neighbours. Due to the proximity of Papua New Guinea, we know that PNG's health crisis could very easily become Australia's health crisis. This is particularly relevant to far north Queensland, with member for Leichhardt, where we have Indigenous communities more susceptible to TB. Australia's border is only 4 kilometres from PNG, and there is significant travel between our countries in these remote communities. But more than the health security risk of our closest neighbours, we have an international obligation to assist our Pacific neighbours in their fight against TB. We are PNG's biggest partner in responding to the rising threat of TB. In 2016, there were 30,000 new cases of TB in PNG alone. According to the WHO, TB kills more people in PNG than any other infectious disease. In 2017, in PNG, 5,300 people died from TB. Just last year, the government in PNG declared a state of emergency in several provinces, including the National Capital District. Treatment for the multi-drug-resistant strains is costly and prolonged and is the most pressing issue in our attempts to eradicate the disease worldwide. Earlier this year, I was invited to attend a parliamentary learning tour in PNG with Save the Children, funded by the Gates Foundation. While there, we visited clinics that are working to combat multi-drug-resistant TB and ensure proper screening and early detection. I was able to see firsthand how the assistance of the Morrison government is providing to Papua New Guinea in providing for doctors and nurses the tools they need to reduce the occurrences of TB in their communities. PNG has a real problem with TB in children in particular, and that's because of the high rates of malnutrition in children under the age of 5. Over 50% of children in PNG under 5 are malnourished, a shocking statistic. And about 7,000 children contract TB each year. In fact, PNG has one of the highest proportion of children in the world affected by TB. Around the world, about 10% of children have TB, but in Papua New Guinea, of the TB community, about 25% are children. But all is not bleak. In Port Moresby, the first cohort of children are successfully completing treatment for multi-drug-resistant TB. There are innovative trials now to improve outcomes, including the direct observational trial. I commend our government on its $13 million assistance package, which will see $5 million dedicated to intensive TB detection and treatment in the Pacific, and in particular $8 million for research into multi-drug-resistant TB. A holistic approach towards combating infectious disease is required if we are to eradicate TB in PNG. We need improved levels of sanitation and health literacy, as well as reduction in malnutrition in children, and this is all supported by Australia and not-for-profit agencies like Save the Children. These initiatives will inevitably result in reducing diseases like TB and effectively save lives. I commend the support Australia is providing to its nearest neighbour on World TB Day. Thank you, Mr.